Hypertensive emergencies. So, hypertensive crisis is a severe and potentially life-threatening increase in blood pressure, which may result in acute stroke, subarachnoid hemorrhage, seizures, as in hypertensive encephalopathy, and heart attack, acute dissection of aorta, heart failure, renal damage, or eclampsia during pregnancy. The underlying cause may be primary hypertension. However, secondary causes of hypertension must be excluded. In adult patients, this often occurs with a BP more than 180-120 millimeters mercury, while in children, this may occur at lower BP levels. So these patients need careful examination to exclude target organ damage. And rapid correction of blood pressure with careful monitoring to avoid a precipitous drop is indicated to prevent organ damage. So the symptoms are headache, chest pain, shortness of breath, nausea, vomiting, confusion, seizures, unconsciousness. The signs that are usually elicited are severely elevated blood pressure for age, unconsciousness, seizures, neck rigidity, lung crepitations. Investigations are chest x-ray, 12-lead ECG, FBC, urinalysis, blood urea, electrolytes and creatinine, brain CT scan for stroke, chest CT scan with angiography for suspected aortic dissection, and also cardiac enzymes as creatinine kinase, MB, CK, that's CKMB, and serum aspartate transaminase as AST, also serum lactic dehydrogenase LDH, and troponins for acute coronary syndrome, and also echocardiography. The main treatment objectives are to limit further organ-related complications by controlled reduction of BP, and also to control and subsequently prevent seizures if present, and to manage identified target organ damage. Non-pharmacological treatments, strict bed rest. So pharmacological treatments, we give labetalol IV in adults 20 to 50 milligrams that over a period of 2 minutes, and repeat at 10-minute intervals if necessary to a maximum of 200 milligrams. In children 12 to 18 years, you give 10 to 30 milligrams that over a 2 minute period, and repeat at 15 minutes intervals if necessary. The maximum dosage of 200 milligrams. So from 1 month to 12 years, by IV infusion, initially give 500 to 1000 micrograms per kilogram body weight per hour, adjusted at intervals of at least 15 minutes according to response. The maximum dosage of 3 milligrams per kilogram per hour. Monitor BP every 5 minutes following each injection for all age groups, and cease labetalol injections if BP is less than 140-90 millimeters mercury or pulse is less than 60 beats per minute in adults. For children, consult a pediatrician, or when wheezing and bronchospasm occurs. You can also give hydralazine IV in adults 5 to 10 milligrams slowly over a 2 minute period, diluted with 10 milliliters normal saline at 0.9%. and is repeated at 20 to 30 minutes intervals if necessary. For children 12 to 18 years, give 5 to 10 milligrams stat and repeat every 4 to 6 hours if necessary. And 1 month to 12 years, give 100 to 500 micrograms per kilogram and repeat every 4 to 6 hours if necessary. The maximum dosage of 3 milligrams per kilogram daily, and not exceeding 60 milligrams per day. Less than 1 month, you give 100 to 500 micrograms per kilogram and is repeated every 4 to 6 hours if necessary. The maximum dosage of 3 milligrams per kilogram daily. So this to monitor BP every 5 minutes following each injection for all age groups. And do not use short-acting nifedipine, for example sublingual, in the management of hypertensive crisis, as it lowers the BP too rapidly and may cause ischemia of vital organs. So referral criteria: refer all patients to a physician specialist for further evaluation.